Hi, I'm Gail,
Hi, I'm Brenda.
and we're here to talk about anaphylactic shock today.
We're going to be discussing anaphylactic shock at both a cellular level and a systemic level. And our learning goals for today are incorporated into the following concept map.
Anaphylactic shock. We're going to search for the definition so we can define anaphylactic shock, review the etiologies, discuss the pathophysiology, what happens to the body systemically as well as at the cellular level when you have anaphylactic shock. Assessment, what are the signs and symptoms the nurse will see, and discuss the interventions to stop the process of anaphylactic shock, as well as what you can do prophylactically to prevent anaphylactic shock.
All right, so let's start with definition. First, we need to review our immune system. It is both a protective and an adaptive system. Sometimes, however, this system overreacts while attempting to protect us from allergens. This abnormal, exaggerated response is called hypersensitivity. So then, let's define anaphylactic shock as an abnormal, exaggerated response to an allergen. It is multisystemic and life-threatening unless emergent interventions occur. Think about a child who's eaten a peanut and who's allergic to the peanut.
Okay. Here you can clearly see a picture of a child who has no allergen response, and here is a child who's eaten a peanut, and clearly you can see the allergic response, the swelling of the eyes, the swelling of the lips, and the rash. There is also laryngeal edema, which is occurring as well.
All right, so let's head on to pathophysiology. In many cases, with exposure to a foreign substance, your body can respond by producing an antibody, also called an immunoglobulin. Remember, immunoglobulins are also called the IgEs. IgA, IgE, IgM, and so forth. Today, we're going to focus on IgE. The IgE immunoglobulin remains in the body and attaches to mast and basophil cells after exposure to an allergen. A second exposure to the allergen will result in these cells releasing a substance called histamine. From here on in, here's a learning tip. We're going to think of histamine as histamine, H-I-S-T-A-M-E-A-N, because histamines can have life-threatening effects on the body. Although histamines can affect many body systems, the two important ones we're going to focus in on are the pulmonary and the cardiovascular system. So let's start with the pulmonary system. In the pulmonary system, the release of histamine will cause several things. Most importantly, bronchial constriction, an increase in mucus production, and an increase in mucosal edema. So let's look at an image of a normal lung and a lung that's been exposed to histamine.
So here's a normal-looking lung where the patient can ventilate easily through the trachea, the bronchus, and the bronchioles all the way to the alveola. When a patient's exposed to an allergen and histamine is released, you will see constrictions. Well, we won't see it, but the patient will experience bronchial constriction, increased mucus production, and increased mucosal edema. So there will be less ventilation to the alveoli all the way down at the end of the bronchial system.
So it's important to remember that the release of histamine will affect both the upper airway as well as the lower airway. Now let's head on to the cardiovascular system. In the cardiovascular system, the release of histamine will cause blood vessels to dilate, which will then result in hypotension. The histamine release will also cause changes in the capillary bed permeability. Fluid will now leak from the vascular system at the capillary level into the interstitial space, and this will compound the already existing hypotension. So now let's look at an image of a normal blood vessel and a blood vessel that's been exposed to histamine.
Here you can clearly see, typically we have the artery, the traveling with fresh blood to the arterioles, and then at the capillary level, where at the capillary level there's the exchange of O2 and CO2, then traveling to the venule and the vein, deoxygenated blood. Now you can see at the capillary level, this is where the exchange is. It's a network of capillaries, very small, fragile capillaries, where they travel oxygen to the cells and from the cell back to the capillary, CO2. Now, with a patient who's exposed to an allergen, you will see vessels that dilate, first of all, capillaries that dilate. The whole network of capillaries will be dilated, and there'll be leakage into the interstitial space. So this interstitial space will be quite large with edema.
So in summary then, the effects of histamine upon both of these systems will not only result in a client who's experiencing hypotension, but also a client is starting to have severe respiratory distress. And now we're starting to see where the shock in anaphylactic shock comes from. Okay, let's head on to etiologies now. There are many, many triggers that can cause anaphylactic shock. Broadly speaking, we can divide them into the following categories: medications,
Antibiotics, anticonvulsants, ACE inhibitors, aspirin. Those are just to name a few. Notice they're all the A's.
Another one is food and food additives.
Kiwis, peanuts, and peanuts are found in multiple types of foods. Shellfish, eggs, bananas are common ones, although there are many more allergens that come from foods.
The next one is the venoms.
Red ants are also called fire ants. Wasps, bees are some of the venoms that can cause an anaphylactic reaction, although there's more than these three.
Medical products that may contain latex.
Latex for one, which could be gloves, Foley catheters, some of the IV types of tubing, and including in products would be imaging dyes and other products, but they're not they're actually related to medication, so to say, because it's a product that would be infused into the patient, would be blood products, can definitely cause a problem as an allergen.
One last thing to add for the client that has a latex allergy. A client who has a latex allergy may also have cross-reactive food allergies. These include foods such as bananas, kiwis, avocados, potatoes, and grapes, among many other foods. Thank you.